Hi everyone, Michael Gimity here from EndoGuides.com, where we design and fabricate surgical guides exclusively for endodontists. In this video, I'm going to walk you through exactly how to take an impression and a CBCT scan of that impression using the Endo Guides Starter Kit. You'll find a link in the description if you'd like to order a starter kit for your practice. When your kit arrives, everything inside will be individually sealed and neatly organized. The box itself is designed to serve as a long-term storage for the materials you'll continue to use as you work with our guides. Inside, you'll find an impression gun, which has been tested specifically with the materials we provide. You'll also receive 2 cartridges of heavy-body VPS impression material. This material has been selected not only for its excellent handling characteristics, but also for its exceptional radio opacity, which is essential for producing highly accurate surgical guides with our CBCT workflow. This eliminates the need for an intraoral scanner and allows us to design guides using only your CBCT files. To go with that, we've included 6 mixing tips that fit the cartridges perfectly and 9 customized impression trays. These trays are clear and marked with blue fiduciary markers in a proprietarily developed pattern specifically for endodontists. These are designed for visibility on CBCT scans and to ensure precision in our guide design. Each time you order a surgical guide from us, we'll send replacements for the materials you used: 2 customized impression trays, 1 cartridge of heavy body, and 3 mixing tips. So you will always have supplies on hand when a case presents itself. After unboxing, the first step is selecting the right impression tray. There are 3 tray types in the kit: one for the anterior region covering canine to canine on both arches, and 2 quadrant-specific trays, one for the upper left and lower right, and one for the upper right and lower left. These posterior impression trays should be used for premolars and molars. While we recommend using a slightly larger field of view than you might normally use in your endodontic practice, these trays are designed to function well even in smaller CBCT fields of view. Next, you'll assemble the impression gun. Start by inserting a cartridge and locking it in place with the top latch. Then press the metal release lever and push the plunger forward until it stops. Remove the cartridge cap and extrude a small amount of material to ensure that there are no air bubbles or clumps. Then attach the mixing tip and extrude another small amount to make sure the material is mixed evenly. Now you're ready to load the tray. The amount of material and the strategy of the impression depends on the type of guide you're planning. For access guides, we only need to capture the crowns of the teeth, so the impression doesn't need to extend into the vestibule, and less material is needed. For apicoectomy guides, however, it's essential to capture the full vestibule. In those cases, fill the tray as usual, and then apply additional material directly into the patient's vestibule in the area you want to capture before seating the impression tray. During this process, have the patient relax their lip and avoid any border molding movements. We're aiming to capture the full depth of the vestibule for this apicoectomy guide without any distortion. When seating the impression tray, apply firm, steady pressure, but be careful not to press so hard that the tray shows through the material. Using enough material here is key. The working time for the impression material we use is 1 minute, and the set time is 1 minute, so a total of 2 minutes. Once the material has set, do not remove the tray. Instead, take the CBCT with the impression still in place. This helps ensure that the tray was fully seated during the scan. Depending on your CBCT machine, positioning the patient with the impression in place may take a little adjusting. If needed, increase the field of view to give yourself more flexibility. Chin rests, like the one on this Merida machine, can also make positioning much easier. After the scan has been completed, inspect the CBCT for 2 things in addition to your normal checklist. First, confirm that the impression is fully seated. If it isn't, you'll see a visible gap between the teeth and the material, like in this case. This is why we recommend to not remove the impression material after it is set and immediately take the CBCT. Secondly, make sure that there are at least 2 or 3 fiduciary markers clearly visible in the scan. These will appear as bright radio-opaque dots and correspond to the blue markers on the tray, as you can see here in this sample scan. Once the scan is complete and is of great quality, remove the impression and inspect it. If you're creating an access guide, you'll want to see clearly defined crowns with strong margins. If it is an apico guide, you also need to confirm that the vestibule is completely captured in the surgical area that you are planning. Now, you're ready to scan the impression itself. Use the impression scanning platform that comes with your CBCT machine. Place the included foam spacer on the platform along with any necessary infection control barriers. Most modern CBCT units include this scanning platform and a foam spacer, but if yours doesn't, you'll need to secure the impression in the scan volume manually. In our testing for these cases, we found that clear Scotch tape works consistently well for this, especially for using bite sticks. The key is to make sure that the entire impression is included in the scan volume and that it doesn't move during the scan. We recommend using the child scanning settings, and all fiduciary markers must be visible in the final scan. Once both scans, the CBCT with the impression in place and the CBCT of the impression itself, are complete and approved by the overseeing endodontist, you're ready for the next step. In the next video, we'll walk you through how to export and upload your DICOM files to our encrypted file transfer portal so we can begin designing your guide. Thank you for watching this walkthrough from EndoGuides.com on how to take an impression and CBCT for our surgical guides. If you have any questions about our process or our design decisions, please feel free to reach out by email or drop a comment below. And don't forget to visit us at www.endoguides.com to schedule a consultation or learn more about how we can support your guided endodontic procedures.